Welcome to The Growing Dentist by Dr. Ali. In this video we will be discussing about teeth whitening. Tooth whitening or tooth bleaching is the process of lightening the color of human teeth. Whitening is often desirable when teeth become yellowed over time for a number of reasons, and can be achieved by changing the intrinsic or extrinsic color of the tooth enamel. The chemical degradation of the chromogens within or on the tooth is termed as bleaching. In 1920s, dentists tried various combinations of peroxide solutions to lighten the shade of people's teeth, for good aesthetics. Today, over 90% of dental offices offer some sort of whitening service. As you can see in the picture A and picture B, there is a difference of the teeth shade prior and after the whitening procedure. There are two types of staining: intrinsic and extrinsic. Intrinsic staining is within the tooth due to chemicals ingested during tooth development. For example, it can be due to ingestion of tetracycline or fluoride. Dental decay, trauma, aging, or tooth that has undergone an endodontic treatment can also lead to its color change. Extrinsic staining is usually from chromogenic food, such as tea or coffee. It can also be due to the use of tobacco products or patient who has a poor oral hygiene. Do you know how staining looks like? Well, cases with tetracycline staining shows a blue-gray or brown shading, whereas chalky white to brown stains appear on the teeth of a patient suffering from fluorosis. There are two types of bleaching treatments: office bleaching and home bleaching. Office bleaching treatment is further classified into vital and non-vital. In office non-vital bleaching, there is involvement of a sigil tooth that had endodontic treatment and its color had darkened. This procedure of whitening is also known as the walking bleach. Sodium hydroxide paste is placed into the pulp chamber, and is left in for a period of time. It may involve 2 or more visits. Office vital bleaching technique usually involves all teeth. This is also called as power bleaching. Sodium hydroxide paste is placed on the tooth surface and then it is activated with a heat or a curing lamp. For the protection of gingiva, dental dam must be used. For home bleaching treatment, a custom tray is made for the patient. Dentist dispenses a gel for home use. Carbamide peroxide is most commonly used bleach. Patient does self-treatment at home with a gel in a custom tray. Patients may purchase tooth whitening kits over the counter. Results of bleaching may vary for every individual. After the bleaching treatment, patients may face some problems in their teeth. Teeth become sensitive to hot or cold. Local gingival irritation might be another problem for the patients. This causes a change in the color of the gingiva, where it appears to be white or reddened, as if it is burnt. Dentists should properly examine patient's mouth before the treatment. Patient must have a good oral hygiene, especially their gingival health. It is very important to take medical history of the individual prior to the treatment. Health professionals must look for any TMJ disorders, allergies, or pregnancy. Dentists should take proper radiographs and evaluate condition of teeth to determine if tooth whitening is indicated or not. One must check the degree of stains, its cause, vitality of the tooth, presence of any restorations or poor oral hygiene. Patients with a gag reflex is not a good candidate for such treatment. During pre-treatment visit, intraoral photos are taken by the dentist. Selection of the shade is done. This includes beginning shade and the goal shade, which is 3 to 5 times lighter. Dentist and patient should agree on reasonable shade goal. In the end, alginate impressions of arch or arches is taken that has to be treated. For the fabrication of a custom tray, pour the alginate impression without a base, trim the model to a horseshoe shape, then label it with the patient's full name, the date, when the impression was taken, and a bleach tray, with the doctor's name onto it. Gingival margins are traced on the model with the pencil or a permanent marker. Lightly spray the model with a silicone lubricant so as to prevent the tray material from sticking to the model during vacuformer process. When delivering the customized tray, try it in the patient's mouth to check its fitness and comfort. Verbally review home instructions with the patients and give them a written copy of it. Avoid overfilling the tray with gel and demonstrate it to the patient. Keep follow-up visits for them too. For free online consultation or any advice, write us in the comments section below, or send us an email, The Growing Dentist team will love to help you out.
Thank you for watching this video. For questions or queries, kindly write us in the comment section below. And don't forget to like, share and subscribe our channel for more interesting videos of dentistry.